Hey guys, I wanted to let you guys know how we determine someone's risk score for suicide while they're inpatient. Uh, we use what's called a CSSR, which is the Columbia Suicide Severity Rating Scale. Basically, this scale combines questions that can be either asked to the person, or it could be done as a self-interview if the person answers the questions on their own. But suicide prevention is a critical component of mental health care. And being able to identify someone's risk early can save their life. And the scale is used as a tool to help providers, clinicians, nurses, counselors, therapists do that. It is used widely across the world by any practitioner who meets people in crisis situations. It's a structured assessment tool used to evaluate the presence and severity of suicidal ideation and behaviors. It's questions, like I said, that help determine whether or not an individual has thoughts of suicide, made any preparations, or engaged in any suicidal behaviors. It's used in a brief interview with the patient, just asking the questions. It takes about 5 minutes total to go through all the questions with somebody. It's categorized, like I said, into different risk levels, which helps determine the appropriate level of care needed. So start with like a 0 score, which is no suicidal ideation. The individual has had no thoughts of suicide. Then there's passive suicidal ideation, thoughts of wanting to be dead or just not wanting to be here anymore. You may hear somebody say that, but there's no intention and there's no plan involved. It's just the feeling that they have of not wanting to go on with their life. Then there's active suicidal ideation without intent. So there's suicidal thoughts, but there is no specific intent to act on them. Then we have active suicidal ideation with intent, but no plan. So a desire to die with the intention to carry out that wish, but there's no concrete plan to do so. Then there is active suicidal ideation with intent and a plan. So they have a very specific plan to end their life, indicating a high level of risk. And then the suicidal behavior includes any previous suicide attempts or preparatory actions. So they've already started, with their plan, gathering whatever they're going to use or do. A higher score obviously indicates a risk for suicide and needs immediate intervention. At this point, a lot of people will be inpatient hospitalization at that level for crisis intervention. At the lower levels, maybe outpatient therapy would be recommended if somebody was just having passive suicidal thoughts. But any active suicidal ideations is generally recommended for inpatient treatment. Risk mitigation and the treatment approaches for someone with suicidal risk. So there's the crisis intervention, which is the immediate safety measures. We are making sure that they are in a hospital being monitored 24/7. And that there is nothing in the environment that they can use to harm themselves. We have psychotherapy, which I talked about in my major depressive video. We have the cognitive behavioral therapy. There's the individual therapy. And there's other evidence-based treatments that can be used within therapy to reduce suicidal thoughts and behaviors. And then, of course, medications. We can use antidepressants, mood stabilizers, and antipsychotic medications, which I'll talk about in another video. Safety planning is a part of someone's treatment. Creating a structured plan, including coping mechanism strategies, emergency contacts, and means restriction, which is basically like removing like firearms or weapons or medications from the home. And then follow-up care, regular check-ins with their provider, mental health professionals, whoever they're seeing, and having an ongoing support network that they can count on. is crucial for long-term recovery. So CSSR, the Columbia Suicide Severity Rating, it's an essential tool that healthcare providers, emergency personnel, teachers, doctors, nurses use across various fields to take appropriate action and identify individuals having suicidal thoughts, and so that we can intervene and help save their life and get them the help that they need. See you next time.